Well, we just finished day 2 of the TruDOSE test drive / training with Mr. Tapley Holland, who's the developer of TruDOSE, as we all know. And I'm very grateful that he took the time to come here and train. We had some, I guess, ideal patients scheduled for this training. Very complex illnesses, Lyme disease, Parkinson's disease, fluoroquinolone toxicity, chronic interstitial cystitis, really challenging patients.
I would say that if you had to pick a patient group to say, if it works in these patients, if it does anything to these patients, then you have me. I'm sold, right? And I think that yesterday and today, yesterday was a great day. Yes, and today just kind of picked up from where yesterday left off. There was 2 or 3 moments that I can recall that were incredibly emotional. The husband and wife. It was just the sign that immediate feeling. The guy with Parkinson's, he was talking better. He was making more eye contact. Even the guy at the end who was walking better, he was noticeably standing up straight, and his gait, the way he moved, the way he walked, was no longer toe heel. It was heel toe, and it was smoother, and his pain was less. I mean, I think the whole day, both days were just emotionally charged moments, because it just signaled a sign of the hope. And I think that's, and I needed to see, these moments never get old for me either. So it was great 2 days.
Yes, for you, it was nice to see, I guess, you respond to these patients and explain with confidence. Yes, I've seen this before.
Yeah,
many times.
Well, I think I think that's because you're dealing with patients. This is not, like we were laughing about. This is not knee pain. These are complex things that the meter hasn't moved a lot, and so the fact that people were talking better, walking better, feeling this, the signs of hope, and I could confirm to them, yes, that's exactly what it feels like, and then expect this. I've seen this type of scenario before, not just once, but 500 times. I think that just reinforces the fact that this is the first treatment, but the second treatment will get better, the third treatment will get better, and then the fourth treatment, and then, but they have, keep in mind that you got to do all the stuff in between too, right?
Yeah. Very interesting to we have patients with chronic infections, Lyme disease, that noticed something in their head, right, or in their brain, which something was changing in a positive way.
When you have all these chronic diseases, the one thing that's really consistent with a lot of them is this emotional state of distress or fight or flight. We said it a number of times today and a number of times yesterday, and that notice in the feeling in the head, or the calmness and the less anxiety, or maybe several people described it as I just feel really chill. Those are huge simple words, but those are huge signs and shifts in the body of healing and the autonomic nervous response coming out of that fight or flight. And it's no light thing. It's no small thing. Those are huge things that, now that is observed, the physical healing can start to happen. And then, obviously, the infectious disease stuff, when they're at the back of the head, that's very typical with Lyme. That's very typical with infectious things, because those are the places where these infectious things, they like to access the brain and get in there and start, rooting around in the nervous system. And so the fact that you can feel things happening and buzzing, those are just signs that that the treatment's actively working on it.
Mm-hmm. Also, of course, I had my own TruDOSE treatment
Yeah.
today, so that was an interesting experience. Now, I'm fortunately in good health and no major complaints. I did develop back pain 3 days ago. It started to get better, and I did feel it this morning, but I'm now actually feeling a lot better, a lot more flexibility in my lumbar spine. I'm actually scheduled to see a chiropractor, which I think I'll still do. I think there's a place for chiropractic care, and I don't think TruDOSE replaces chiropractic care. But I do feel that my back is better. You know, it's been a tough day, standing, walking.
Well, you've been on your feet all day.
Exactly.
When we did this video earlier, I asked you how you're feeling. You hadn't noticed anything yet, and so that just signaled to me that you're just not going to say something is better if it's not better.
Yeah.
And the fact that you're saying something's better now must mean that it is better.
Yeah.
Right.
And of course, we've had discussions about musculoskeletal issues. I guess we distinguish between certain kinds of joint pain. Some are isolated, and some are associated with, I guess, systemic symptoms such as insomnia or whatever. Right.
Right. Kind of what we found is many people walk into an office with joint pain, and when you really look at it, it's not joint pain at all. That's definitely the reason why they're walking in the door, is complaining that their joints do hurt, which is that's not a debate. But then you have to ask the question, well, why is the joint hurting? And what we found is that you can really isolate and find out for yourself really quickly if it's really a joint issue. Ask yourself, how do you sleep? Because if you sleep great, then that's usually a sign that it's not something systemic. But if you don't sleep great, that's the first sign. The second sign would be, okay, I have knee pain, but ask yourself, do you hurt anywhere else? 9 times out of 10 people have back pain, shoulder pain, brain fog, and now you can just say that it's no longer knee pain. It's now something upstream wrong with the body that's causing and displaying itself as knee pain, right? So that's really the way to kind of say, well, do I need an injection here in the knee, or do I need to give an injection around the body and let that work? Or kind of what we talked about today is maybe the combination approach is the best approach, where you can kind of hit it systemically and also with the site specific at the same time. But that's something when you talk it out when you're in the office.
Definitely, yeah. Often, I guess, misunderstood, right? Often doctors focus on the patient's chief complaint, right? They have joint pain, they want to put a needle in there.
It makes sense. It's easy to do. Go where the pain is, right? But I don't know you could do that. Not with the patients that we've seen the past 2 days. I mean, there's no doubt that everybody had joint pain to a degree. The last gentleman, he told us that he had pain in his hips and I think both hips, obviously pain, I think he said in his knees, but that wasn't his problem. And then after the treatment, he started walking around. He's like, I think my hip is better, and my other, it's all my pain is way down. Now this is someone that was dealing with a serious neurological condition, but he's got joint pain. Mm-hmm. So again, is it joint pain? Is it really joint pain? You also see that a lot with hair loss. Is it really the fact that you're losing your hair because you're getting older? Or is the fact that it's something inflammatory underlying? So if that's the case, we've been talking about this the past 2 days. That's another place where you just simply would not inject the scalp to make the hair grow. Mm-hmm. If you give the systemic treatment, you'll calm down whatever causing the hair being lost, and then the next treatment, then inject the head, and the hair will grow tremendously. So, but you have to do it again. You have to do it at the right dose. Because joints and hair are two of those conditions where you have to have enough, but if you have too much, it could actually cause retardation.
Okay.
Whereas the systemic is one of those things where there's you have to have enough to stimulate the response, but too much is too much. Mm-hmm. So that's kind of like the difference.
Good. So certainly one of the reasons that I chose to do the TruDOSE today is because I want to make that part of my overall wellness anti-aging program.
Right.
Just like I recommend bioidentical hormones to my patients, good nutrition, good diet, proper sleep, and all that. So I have a question for you. Some patients are interested in stem cell treatments, and of course you have a lot of background in that. What would be your advice for patients who are interested in stem cells in terms of, I guess, integrating it with a TruDOSE regimen for, say, anti-aging or just other reasons?
I'm totally pro stem cell, and I've also learned with TruDOSE that there really is applications that work best for stem cells. And so if somebody was considering stem cells, the first thing I would say, if it was me, is you need to calm down the inflammatory storm of whatever's going on with us. And typically most of us all have the inflammatory storm. So if you have infectious disease and things like that, that's not the case where you get stem cells. You need to calm it down. So a TruDOSE or two, and then get stem cells, and then the stem cells will have the TruDOSE will have paved the way for the stem cells to actually do what you wanted them to do. And that's the reason why you have the mixed results with the stem cells. It's not because they don't work, it's because they're often given at the wrong time. And so the body heals in a certain sequential order. Many of us are stuck early in the inflammatory process, but stem cells are needed at the end of the healing process. That's not my opinion, that's just a fact. And so if you're someone who's later in the process, stem cells will work great. If you have infectious load and you're a lot of inflammatory issues, it's just going to cause more problems. So stem cells are great, especially for anti-aging. I would, if it was me, I would do a TruDOSE or two, stem cells. Yeah, you would totally have the anti-aging, the preventative package. And also TruDOSE, there's evidence on this that TruDOSE platelets actually bring cells out of, stem cells in our own body out of hypersleep or senescence, which is, I call it hypersleep. Basically that, the more stem cells we can have operating our body, the less likely we're going to go into age-related diseases. So our body puts these cells into hypersleep purposely, and that's how we get age-related diseases. But platelets with a TruDOSE actually bring them back into the ballgame. And so they've had evidence on that in mice. They have evidence of that now in humans. Not necessarily with TruDOSE, but just platelet function in general. So it's kind of cool.
Yeah, very cool. And so with the, say, intra-articular TruDOSE treatment, we have protocols for that too.
Yep.
Of course, right? So I know, I guess most orthopedic doctors will recommend PRP injections every 4 to 6 weeks or spaced apart, right? How's it with the TruDOSE treatment? Do you find it's different?
It is, and the reason it's different is because you're actually doing a dose-specific treatment, and I think it just stops there. The reason that most offices offer joint-related injections and they're offering 2 to 3 to 4 treatments is because the first, the second, the third treatment didn't really work, and they didn't work is because they didn't have the right amount, they didn't have the right strength. And so again, joints are a condition where you have to have enough or they won't stimulate a response. If you say, well, I'll just put a bunch in there, then the analogy would be putting too much fertilizer on your lawn. the right amount makes the lawn green. Not enough doesn't do anything. Too much burns it. That's the same thing for a joint. So with the TruDOSE, you get the right amount. And typically what we see is with most joints, I would say greater than 90% of the time, it's a one and done treatment. If it is a true isolated joint related issue, it's typically one treatment and done. You're done with that problem. Versus having 2 to 3 to 4 treatments of minimal effectiveness.
Yes.
So that right there is really the big difference. And so if I was a patient, really thinking where should I go, I would consider that. I would just say to the doctor that's not you, how do you know what you're giving me? Are you giving me the right amount? Mm-hmm. They're probably going to respond. And they're probably going to respond with, I don't know what that amount is. But here Here you're going to test somebody, and then you're going to confirm that we did get the right amount. And so there is some assurance to the patient that, you're at least doing the best you could possibly do. And then obviously, like I said, that it's typically a response of one and done.
That's awesome.
Yeah.
Big time and money savings.
I mean, I think the important thing is that education and knowing that the treatment's personalized. I think that most people understand that value, and they appreciate it, right?
Yes.
Versus multiple treatments and keep going back and back with minimal effectiveness. Everybody wants an alternative to surgery, but you also want something that's actually going to work when you're paying cash. It's not insurance based. Mm-hmm. So that's really the crux of the problem that TruDOSE really solves in those situations.
Great. Well, we discussed a lot of other things
today.
We could probably go on for another hour or so, sharing experiences, and actually you have a wealth of knowledge and experience. Any final words for anyone listening?
I think that if anybody I wish anybody who's listening to this could have seen what happened today and yesterday, because it never gets old for me seeing, I guess, the fruits of this labor and people getting better and healing, and the prospect that finally they found something. And I've said this now, I guess 2 or 3 times on the videos we've done, is that everybody consistently, even today, even by the end of the day, was saying just how great of an experience they've had here with you. And so, I feel like we're lucky to have you. And I think all the different tools and things that you have here, for anybody who's out here listening, anybody who's going to refer this video on, there's a great option here. And I hate to say I'm pleasantly surprised, but I am, because every patient had nothing but great things to say. So, and that's important because, in the right hands, TruDOSE does great things. And so, yes, if I was a patient, I would definitely be, and you're looking for an option, I would say this is a great place to come.
Yeah, and of course, it doesn't mean that we're not going to do ozone, it doesn't mean we're not going to do, laser or other things.
Right.
Everything else is still important, but the key is we want to, sequence things and pace things appropriately.
You do. TruDOSE is just, I don't want to give the impression that TruDOSE is everything you need, because that's not the case. That doesn't take the place of diet, that doesn't take the place of ozone. Actually, and the two things together become kind of like the peanut butter and jelly that you need to do for many conditions we treated today and yesterday.
Yes.
And so, but all the tools here, when you have all the conditions that we treated, you have everything that you have here for somebody who needs help. And I think TruDOSE just made this place just that much more enhanced. So everything that somebody needs is right here. So
yeah, definitely, and everything else will just work better. Will break through some, I guess, barriers that
100
kept patients from progressing.
100%. And I think that even some of the patients that you had who totally trusted you and said, you're the only one who's gotten me thus far, were saying just that you had these other modalities, but I'm glad you have this because I can feel the next progression in me right now. As I'm sitting here, I can feel it. And so that's just good because all the other modalities that you have now can now be implemented, like you said, in a sequence to where patients can get expeditiously healed. That's cost savings, that's back to your life, that's back to your activities, that's back to many, many things that people were talking about that they cannot wait to get back doing.
Great. And finally, of course, you have big plans for TruDOSE. You're traveling, you're going to be on social media, you're going to present at certain conferences, right?
Yep. Everybody needs to be on the lookout because this fall and this winter we'll be at several autism conferences. Most of them are patient facing, and I think one or two of them are patient and doctor, and also Lyme. So I think the secret's out that of what TruDOSE is doing for those two types of conditions, and we've got data that we're collecting that we're going to be presenting. I'm presenting on some data with Lyme. We have some data we're presenting for autism and PANS and PANDAS. So, and this is obviously no one's immune from the PANS and PANDAS, but Lyme is really big here in the Northeast. So yeah, be on the lookout for us on the social media, because for the longest time we've been kind of careful to not put too much, if hardly anything, out there, but that's going to change.
Awesome. People need this. People are looking for this.
Yeah, absolutely. And so just be on the lookout. TruDOSE.com. And again, look at all providers. And now we have one great one in Maryland. So this is great. This is awesome.
Well, thank you for your attention. We're going to wrap up the day. It's getting late, but it was an awesome day. Awesome 2 days.
Yeah.
So we'll give you updates again. And actually, it's going to be a Zoom meeting in 3 weeks. We'll send out the date and time.
Yes.
And of course, everybody is welcome. And it's going to be, what do we call it?
We call it, what does healing look like?
What does healing look like?
It's everything we've learned from thousands of people healing from their own mouth. And compiled it basically. And what have we learned how the body heals when you do this treatment? It's my favorite of all the Zooms because it's not just explaining how the body heals, but it's listening to people get better, and then listening to other people who are quiet on the Zoom. It turns into almost like a group therapy, and it's my favorite. So it's great for everybody who just got the treatment the past 2 days, but more importantly, anybody who wants to jump on who's their first introduction to this. It's good for them too, because you're hearing real people who've had results and have experience, and it's raw, and you can ask them questions. People are really open. It's just it's always a great Zoom call.
And of course, we'll hear from the patients who were here today,
Absolutely.
yesterday.
Right. That's in. I would encourage anybody who's watching this to come on there.
Okay, so see you again soon. Good night, everyone.